Good afternoon. I see folks beginning to join. Could someone give me a sound check? Can you hear me clearly?
Yes, we can hear you.
Great, thank you very much. And we'll take a moment for everybody to log in. I'll ask if you would in the chat, put the names of the individuals who are on your site, particularly if more than one person is on a Zoom link, and the name of your facility as well. And for those just joining, if you would put in the chat box the name of your facility and those individuals who are joining, as we want to be sure we record attendance for everybody who's here. And let me remind you that this session is being recorded, as all of them will be. And while folks are logging on, good afternoon. Special shout out to my heritage colleagues. I received a patient from you to my medical service last evening. We will not have any HIPAA identification, diagnosis, or name, but let me just say we received wonderful information on our patient, and I just want you to know that she's doing well, and we'll be coming back to you in a few days, but very appropriate for hospital transfer, and always a pleasure to be working with you.
Well, thank you for sharing that.
However, we did not get our Maryland SNF to ED form. I did look in the paper chart. Are you using that form?
No.
I'll make sure you get a copy of it, Will.
Okay, thank you.
Thank you. And I want to make sure that if our discharge summary is not up to par, that you please reach out to me so that I can share with my team how we might do better as well. Okay? Thank you.
Okay, thank you.
Great. Everybody's logging in on the chat box, the names of the facilities, the individuals who are participating, so that you do get receive credit for your registration and participation. So thank you so much. And I think we're just about ready to start here. All right, I think let's go ahead and begin, and a good afternoon. I'm sure we are all very busy and very challenged right now across the country, certainly here in Maryland and certainly here in Baltimore with our increases in COVID care. And actually here at Johns Hopkins at 5 o'clock last night, we went to code purple. I actually thought we stopped at red, but now we have purple, and purple is really the highest level, and no visitors except end-of-life care and emergency staffing. So we are going to emergency 12-hour shifts for medical staffing for all of our new COVID units. So we're all in this together, and look forward to working with you even more. So today's topic is PPE, personal protective equipment, and this is a particularly important and relevant topic right now. Before we begin, I'd like to introduce this group to Dr. Victor Boguslavsky, and he is a public health physician, and Victor, if you could say hello. He is with us from IHI and will be giving us expertise in quality improvement. So Victor, you have the floor.
Thank you so much, Michelle. Thank you, everyone. It's just an honor and privilege to be with you, with your so busy time. extremely grateful for the opportunity. I'm the HI's Improvement Advisor. As Michelle said, I'm also a public health physician. And I'm very much looking forward to working with you over the next weeks as we move forward. Thank you so much.
Great. I'm glad to have you with us.
Thank you, Michelle.
Okay, so let's get right to our topic for today, personal protective equipment. I'm going to begin by sharing my screen, and we're going to view a video. Let me get to the right place here. Oops. And give me 1 second, and I will get, fortunately, my controls here are where I need to be to get my video. Oh, there we go. Okay.
Or PPE guidance and practical approaches for improved outcomes. This presentation will provide you some key information on sharing with healthcare staff on what PPE is, how to determine their inventory, and when it should be used, how to use it, and procuring PPE and more. It is essential for facilities to identify our policies and procedures for PPE that are consistent with state, CMS, and CDC guidance in order to give good direction for all employees to follow. Once systems are in place, giving up to date with any new guidance on PPE use is essential, as we know that guidance has changed rapidly as the industry learns more about this new or novel virus.
Having a good understanding on transmission is going to be important for all staff in order to make sense of how to protect themselves. We know that the primary mode of transmission is from person to person when an individual coughs, sneezes, speaks, and even sings. But yet, it is so important for all staff to also understand that the environment plays a role as well. Let's start out by discussing the primary mode of transmission, which of course we know is person to person. This is why universal source control, when there are no cases in the facility and a low community prevalence, is important. And that means all staff, residents, consultants, visitors, and vendors must wear face masks. Wearing a face mask or respirator will protect in two ways. First of all, to prevent you from potentially spreading a virus to other staff or residents, because there are a percentage of people who can be either asymptomatic, meaning infected and showing no symptoms, and some people who have COVID-19 never have symptoms or have very mild symptoms that they think may be from something else. Or there's also pre-symptomatic, meaning you may be infected and do not show symptoms yet, but may develop them as the virus progresses. The second reason is because you want to protect yourself. Residents should wear a cloth mask if they leave their room. In addition, they should wear a cloth mask or cover their nose and mouth when staff are providing cares, if that's tolerated by the resident. PPE, or personal protective equipment, is intended for protection. All staff understanding the use of PPE for standard and transmission-based precautions is going to be crucial for compliance.
Even with the new testing and screening protocols, it's essential to be vigilant with monitoring for COVID-19 signs and symptoms, as we see here on the screen, in order to put prompt actions in place for mitigation, such as resident placement and, of course, PPE use. For example, continuous education for all staff in an organization on COVID-19 signs and symptoms, as we see here again on this slide, is very important. So for example, when someone is hired and goes through orientation, so much material is covered that repeated training on COVID-19 is essential. The premise is, of the more they hear, the more they know. Education on PPE use, the why, the when, the how, and the what, is important to reduce the spread within your organization. All staff have received training on COVID-19 and PPE use, but ongoing education is very important as we get into COVID-19 and PPE fatigue. So we have to make sure that our staff have the ability to demonstrate their competency in the use of PPE.
As Lisa indicated, immediate action is crucial in order to prevent the spread of infection. Therefore, an immediate response would be standard precautions. infection prevention practices that apply to all residents regardless of suspected or confirmed diagnosis or presumed infection status. Standard precautions is based on the principle that all blood, body fluids, secretions, excretions, except sweat, regardless of whether they contain visible blood, non-intact skin, or mucous membranes, may contain transmissible infectious agents. Furthermore, equipment or items in the patient environment likely to have been contaminated must be handled in a manner to prevent the transmission of infection. Transmission-based precautions or isolation precautions are actions that are implemented in addition to standard precautions that are based upon the means of transmission, airborne, contact, or droplet to prevent and control infections. With COVID-19, appropriate use and appropriate putting on and taking off, or donning and doffing, of PPE will help in the protection of the spread of infection for you and your residents. PPE use will be essential for all staff that are caring for the resident, entering a unit that is COVID-19 positive or quarantine residents, and for employees who clean and disinfect the resident's room.
It is important for our staff to understand what is PPE and why do we wear it. Once again, PPE is intended for protection. When our employees start orientation, or at least once a year, or more often if there's an outbreak or infection control concern, staff have been trained in standard and transmission-based precautions, PPE, and how to use it. If it is not used for a period of time, re-education is extremely important. Now, with this pandemic, PPE use, misuse, or lack of use can be one of the factors that can contribute to the spread of COVID-19. So therefore today, more than ever, it is really very important for all of our staff to understand what to use, how to don and doff using proper sequencing, if it can be reused, and how to follow the policy for extended use, and the importance, of course, of hand hygiene as well.
The CDC clearly outlines that PPE is necessary for healthcare employees for a multitude of reasons: to protect themselves, to protect the residents, to protect others when care is provided. And in addition, it is also used to protect employees from other hazards that you may encounter in the facility. And during this pandemic, proper protection can contribute to the prevention of the spread of infection, not to mention the potential of life or death due to this extremely virulent pandemic. There have been so many challenges we have encountered with PPE during this pandemic, from lack of adequate supplies to staff identification on how to optimize the use when supplies may be low and in demand. Also, lack of follow through with proper use and direction due to a multitude of reasons from frontline staff. The day-to-day realities include that staff are not always donning and doffing properly. They sometimes touch PPE without performing hand hygiene, heat exhaustion from wearing PPE, and more. It is really everyone's responsibility to coach each other, support each other, and speak up when they see something that isn't quite right.
Stressing to our staff what is and what is not PPE is very important. When re-educating our teams, it's important to show them and discuss with them the types of PPE used in your organization. So as seen here on the slide, PPE for our facilities includes gloves, which it's important that we're stressing to our team that gloves must be changed between each resident if soiled or you see that there is a rip or a hole, and whenever going from a dirty to clean situation. Hand hygiene must always be performed both before and after each glove use. Gloves should never be kept in your pocket. Gowns, of course, is another type of PPE, and sometimes the same gown can be used for different residents if they have the exact same infection and you're in the specific PPE optimization strategy. You will need to follow your facility policy and procedure and directions. You can never wear a gown when going from a COVID positive unit and then off of the unit. Eye protection, of course, is another PPE, which can be either a face shield or goggles that cover the sides of the eyes too. And face masks, of course, are the medical, surgical, or respirators, but not cloth face masks.
It is important to understand that today with this pandemic across the country, almost all facilities are experiencing some types of shortages in regards to the PPE that they use. And through this pandemic, Most facilities, even hospitals, have been running short of PPE and even out of their supply. There is guidance from the CDC on how to optimize the supply of PPE when those supplies are low, and we will be discussing that a bit shortly. The CDC, or Centers for Disease Control and Prevention, and the states have identified PPE alternatives, but they are not considered PPE. That include, once that facility runs out of PPE or have exhausted their supply, cloth face masks. Now, cloth face masks can be worn by residents, but not by staff unless you are completely out of PPE. Bandanas, scarves, those are not PPE. Rain ponchos, disposable or reusable lab coats, reusable resident gowns, disposable aprons, the patient gowns that sometimes facilities call Johnnies, so to speak. Those are not, once again, considered PPE, and it should be very clear that staff understand that these are PPE alternatives and are only to be used after all PPE is exhausted.
As we have indicated previously, for universal source control, all facility staff must wear face masks while in the facility, even when in your offices talking with each other. As we all remember, on April 2nd of this year, CMS provided that guidance to us that if there are COVID-19 cases identified in your facility indicating community transmission, employees should wear the recommended PPE for the care of all residents. We also want to follow all state and updated federal guidance as well. And in July, the CDC added a recommendation that employees working in facilities located in areas with moderate to substantial community transmission should wear eye protection in addition to face masks during patient care encounters.
We have been suffering from information overload for over a half a year now, and we want to make sure we're using valid, reliable guidance when making decisions on our policies and procedures for PPE decisions. Areas where we can find those excellent resources include our state and local Department of Health, CDC, CMS, also the U.S. Federal Drug Administration, the FDA, U.S. Department of Labor, Occupational Safety and Health Administration, or OSHA, the QIOs, and provider associations. As we know, PPE shortages have been a challenge in all areas of healthcare. And in order for us to be able to optimize and have a solid process for staff direction when supplies are running low, facilities need a system to identify their inventory, their need, and their capacity. And by completing a burn rate, and CDC does provide a link, as many of you know and many of you are using, to plan and optimize the use of PPE. The CDC has determined there are three general, what they call strata, to describe surge capacity to lead measures to conserve and prioritize PPE. There's conventional capacity, which is measures that are already implemented for general infection prevention and control that would be in best practice approach. Then there's contingency capacity, which are measures that are used temporarily during anticipated PPE shortages. And then there's crisis, which are strategies that are not consistent with US standards of care, but they may need to be considered when there are PPE shortages, and they should only be implemented after considering implementing conventional and contingency supplies. So decisions to implement contingency and crisis are based on your facility understanding your inventory, understanding PPE, utilization rate, communication with local healthcare coalitions, your federal, state, local health partners, that you've already implemented conventional measures and have provided your staff with the required education and competency and have them able to demonstrate with donning and doffing any PPE that they are using to optimize the use. There are web links on this page for each type of PPE to give you strategies on how to optimize during shortages.
We also know another process of PPE is tracking and recording, and it's a key element to success related to your inventory of PPE and use, as well as compliance, given the new regulations, as we all know, that are in effect with reporting of PPE. When it comes to PPE, facilities we know are required to track and report supplies and personal protective equipment on the NHSN long-term care facility COVID-19 modules, as you see here on the slide. So we know this information is to be reported weekly and can serve as a benchmark for facility leaders and your team members to review quality improvement activities as it relates to PPE use and needs. So now that we have given you just a brief overview of some of the PPE guidance that facilities need to adhere to, let's discuss some operational approaches that are practical and realistic as we navigate through this pandemic. As leaders and caregivers, there are a few questions that should be considered when designing your overall PPE strategies, while asking team members for their input as you really develop your practical approaches to PPE use, optimization, and practice. And as you can see here, here are some of the questions that I would recommend that you download and take the slide. And again, it's a nice refresher for all of us, where, as Sue indicated, it's 6+ months that we've been in this pandemic, and now is the time we need to take a refresh and look at our PPE processes and our practical guidance and approaches. So as you can see here, some of the questions that you want to look at. You know, do we have that contingency plan for our shortages? Are there updates with the vendors that we work with right now, and possibly new procurement sources that we have in place? You know, again, is it available outside of resident rooms, our PPE? And then our trash receptacles, again, trash receptacles, very important that they're located in strategic locations near the exit of the resident rooms. And again, looking at when you're doing your process surveillance reviews, are your residents wearing face masks when they leave their room? And are all employees wearing face masks, not underneath their chin, underneath their nose, above their head? Are your employees wearing face masks appropriately while in the facility?
It's essential that facilities have updated policies and procedures that are based upon current guidance for training and reference for all employees. And examples would include source control and resident use of masks, not wearing N95s, cloth masks, selection, use, donning and doffing of PPE, including that proper sequencing. Also, CMS has given the directive that facilities must ensure all staff are using the appropriate PPE when interacting with residents. And of course, full PPE, gloves, gown, face protection, and mask or N95 for the care and interaction of any resident with known or suspected COVID-19.
The second practical approach and guidance that we want to remind everyone is determining our supply needs. So facilities, as we're looking at our inventory, our use, and our supply needs, again, we know that shortages have been a challenge in our settings and across the country, but therefore having a solid system to identify your need and your ordering capabilities, again, as we look at current state and potential state of COVID resurgence in your geographic area, it's very important for you to look at your capabilities, because it's instrumental in your ability to provide the necessary protection for yourself, your residents, and your organization as a whole. So if you've not developed or truly refined your system in your facility to plan and optimize the use and supply of PPE, again, as Sue indicated before, that burn rate calculator is there. And many of our organizations, we're using a process or one that aligns with this CDC burn rate calculator with its intentions and goals. And again, the overall goal is making sure that we have an ongoing supply and we have the protection and the equipment that we need in order to provide that great care and services to our residents. So now is the time to review our processes again and make sure it aligns with our organization needs, our current resident population needs, and assisting you in anticipating supply needs so that your team is able to meet the overall needs of your residents safely and in alignment with current guidance.
And as Lisa indicated, it's going to be important to keep that stable 2-week source of PPE, and that includes face masks, respirators, gowns, gloves, and eye protection. The only way that you will know what you will need for those 2 weeks is if you do complete an evaluation such as that burn rate calculator. If you are running low on PPE, and if you're unable to keep 2 weeks in stock, then you may want to check if you have any sister facilities for assistance if needed. Keep checking in with your vendors, check with your state HAI coalition, and keep documenting all of your attempts to obtain PPE.
The third practical guidance and approach as it relates to PPE use, and we talked about earlier, the importance of education and verification of competencies. These are crucial components of compliance and are the cornerstone of prevention of COVID-19. Having trained leaders on all shifts to be able to not only train or retrain, but to take the time to really observe where all the gaps are in understanding for your staff, that will help you to determine the gaps in performance and do the right thing all of the time. Education, demonstration, return demonstration, and observation on an ongoing basis is instrumental for success when it comes to choice of PPE, donning and doffing correctly in the right sequence and not contaminating themselves, and when we are using contingency or crisis capacity, for example, extended use of PPE, that we need to verify our employees' understanding with the training and where you're currently at and your current status within your organization.
On the slide, you can see these excellent posters that are available for you to use from the CDC for identification of exactly what PPE to use, as well as directions for donning and doffing. Keep in mind that facilities will want to keep up to date on any new developments because they have changed with guidance. Since these posters were originally posted, they have added a statement about the importance of evaluating the selected respirator and eye protection so that there wouldn't be interference with the correct fit or function of each item. The CDC also removed the second hand hygiene steps on donning from the previous version. So it's important that we keep monitoring for any updates to these resources. And then downloading, laminating, and posting them in multiple areas for staff to use as a resource is going to be very helpful. Visuals can be really important when it comes to staff along with demonstration for compliance.
Once again, we really want to emphasize the importance of a good system for training, verification of competency, and ongoing monitoring. This is a perfect time to look at the culture of our staff working together, assisting each other, and identifying if there are areas of opportunity. Designating a lead employee, once again, on all shifts to really mentor, identify concerns, correct practice, and hold staff accountable for quality will be very helpful in this process for quality and compliance.
Step number 4, optimizing PPE. As we mentioned earlier, one of the key strategies is to have that good system in your policies and procedures for optimizing your PPE when you get to a certain threshold. And this is when you will need a clear process that is directed to staff for when you move into contingency or crisis capacity with PPE. And you will need to now direct staff on how to manage the use of PPE with that guidance that's outlined by the CDC. And then moving forward, ongoing auditing and mentoring will need to be provided on all shifts in order to be sure that staff are following through successfully with those directions.
The 5th practical guidance and approach is surveillance. Process surveillance audits will be very important at this time and have been in the past, but now as we're talking about PPE, extremely important. The infection preventionist or designee can audit staff on all shifts using a PPE audit tool. Audits can include preparation and choosing of PPE, hand hygiene, donning and doffing in the appropriate sequencing, and more. If you, again, having a lead PPE team member on all shifts, they can assist with the surveillance process as well. Working together as a team will assist in increased adherence to the best practice standards. The results of these audits can assist your organization in determining ongoing education needs for quality improvement.
And number 6, performance improvement. Identification of areas for improvement is a great step. It's that first step. Then completing a good root cause analysis of the situation in order to improve performance is important. Identifying what the staff are doing and why they are doing it is a very important process. So, for example, you may see the staff have their masks hanging from their chin or their nose is out, or they are touching the outside of the mask without performing hand hygiene, or you see they are spraying gowns with List N disinfectant and reusing them. Is this consistent with the manufacturer's recommendation? Could the spray damage the protection of the gown? Is it safe for the employee who is wearing the gown that is being sprayed? Who decided this practice? How long have they been doing it? And more. Good observations of practice will then be able to assist in providing good systems and education for all employees.
The seventh step, or the final step of the practical guidance and approach as relates to PPE use in your organization is supporting team members, and it's a key strategy when we discuss PPE use and optimization in our settings. We know that this pandemic has brought about many challenges for organizations and our staff. We know PPE fatigue is present in most facilities across the country, and the ongoing use of PPE was not commonplace for all of us prior to COVID-19. So it's important for all of us as leaders, as well as team members, to create a culture of ongoing support during these unprecedented times. This culture provides a safe environment for staff to openly discuss vulnerability, stress, burnout, and other barriers to their well-being. Having those hard conversations, for example, as it relates to, do we have access to the appropriate PPE? Or being exposed to COVID-19 at work, and then they're worried about taking that infection home to their families. Or discussing how to overcome some of the challenges of wearing PPE all day long, the heat, potential skin issues or concerns, time constraints, and exhaustion. Collaborate with your team and peers to identify creative solutions to address those needs. Your team is a vast resource of knowledge and ideas, and working together will help foster a supportive culture at your facility and improve performance outcomes. So again today, in summary, we want to talk about the key points that we emphasized in our practical guidance today. We know that facilities have to have updated policies and procedures and systems for the use of PPE consistent with state and federal guidance. Second, we know that facilities will need to understand inventory and supply in order to be able to use PPE in the way that it's intended and is essential for quality and outcomes. So if there's shortage, prompt identification and action is essential. Comprehensive training and competency verification for all staff is key, as well as ongoing education and training. And it should include best practices, state and federal guidance, as well as your facility policies and procedures. We talked about process surveillance, monitoring, auditing, and also the identification of quality improvement activities. And of course, creating that supportive culture for your team members and providing ongoing support is essential to foster adherence to PPE standards and expectations. Again, we want to thank you for taking time for this brief presentation on the use of PPE and practical approaches for safety and quality outcomes.
And here are some resources and references that will be on our library, and particularly the Genesis section library of the IHI website for all of us. So we've started with our learning objectives of understanding the types of PPE through that video, when PPE is necessary, and some practical tools for supply, optimizing, and training staff. But I'm going to stop sharing my screen right now so that we can all see each other, because we certainly are aware that Genesis has very robust policies and procedures for PPE. And so I'd like to start with a discussion of what's been going well with PPE in your centers. And if anyone would like to start off by celebrating some successes with respect to PPE.
I think we've come a long way with the supply of PPE. Just thinking back when this first started, the supply was extremely constrained. And now I think we are in a much better place.
Yeah, absolutely. And also the type of PPE. So I'd like to do a little fashion show if I could. I won't put my mask on so that you can hear me a bit clearer, but we started in March with our medical student made Home Depot face shields here at Johns Hopkins. So we've got some lovely foam that was glued on to this plexiglass. It's pretty heavy, with a very strong band that was stapled with an industrial strength staple gun. truly made by our medical students. And we did the best we could, and they are extremely uncomfortable. They kind of push at your head and gave a few folks migraines, but we got started when we needed to. But then we're Johns Hopkins, so we have to be really fancy, right? So then we got the $25 version that's made by a local startup company. Isn't this lovely? Look at this. Is this high tech? You like that? What do you think one of my dementia patients said about our headgear? They called us Dr. Frankenstein, and in fact was rather frightening for a dementia patient when we all walked in with these bolts coming out of our heads. And I think there was even a mention about shock therapy during those rounds. So let's all go to great good old Amazon and Googling, and what did we come up with? And by the way, it was a great nurse who came up with these. These are the face shields that work very well for those of us who don't wear eyeglasses, but they're very lightweight. With room, they don't fog up, they're very clear, and they're very lightweight. And in fact, I basically wear these all day long. Currently, I'm in my administrative office with the door closed. There's no one else here, and I'm talking to you, and I want to be sure you can hear me and communicate. But otherwise, the rest of my day, I have my surgical mask and my face shield on, and I just leave it on all day long. That way I don't lose it. It's very lightweight. So anyone else come up with some good PPE that's been easy for staff to use and to be compliant with?
I don't know if we have anything that's like easy to use, but I do just want to give a shout out to our local health department. Has been amazing. I just received a huge shipment today. I actually only put in for disinfectant wipes and some N95s, and I got gowns. They had a supply of gowns. So the local health department, if you use those forms, and I know each health department is different, but I'll give a shout out to the Frederick County Health Department. They've been amazing with making sure that we have what we need. Genesis does a fantastic job. I've never had any concerns, but when I hear stories from others, we're just definitely blessed, I know, at this center with the collaboration with our local health department.
Great, thank you, Cassandra.
Let me show you this. Hi, I'm Deborah Tanner, everyone.
Hey, Deborah.
So, hi, all the staff hates them. All the staff loves them. These are the ones that bite into your face because I wear them too. So they bite into your face. They're highly uncomfortable. And sometimes the metal piece on these will cut into your face. If there's any way to recommend these, they're 95s. They don't fog up your glasses and they're quick. Rather than struggling this on and off of your head with extremely tight rubber bands. So that's just, if I was going to sell something, I would sell these. Thank you.
Great. I'm also going to show you my fanny pack, my Johns Hopkins fanny pack with my little Hopkins button on it. And that's where we store our N95s so that when we are not on the COVID unit, we have a place that we can store them during the day so that we don't lose them and we can reuse them safely and use our surgical masks when we don't need to have an N95. So I thought those were really nice. My husband works at a University of Maryland hospital, and they received them from Under Armour as well. So a local supplier trying to make our everyday work a little bit more fashionable and fun. Yeah. So what keeps you up at night, wakes you up in the middle of the night about PPE? I can tell you I'm not woken up at night, but every morning this week with I have 2 interns and a resident, and every morning I've had to remind one of my interns to go back to his office and get his face shield because we can't start rounds without him. And every morning we have to say it again. And more than once on rounds, I have to remind him to get it off his head and onto front of his mask as we're entering a patient room. So it certainly is challenging for, we all have PPE fatigue and burnout, and for some individuals, it's particularly challenging. What challenges you?
I was just going to say the PPE fatigue. It can be some of the best staff in the facility. And then they forget and do the this on top of the head for whatever reason, and then start to walk in and go, you know. It's hard. 8, 10, 12, in some cases 16 hours a day. It's hard.
Yes, it is.
So we just keep making it fun, and we're heroes. We gently remind people. Don't forget.
Absolutely. Is Cricket Cook on the line from Glad Valley?
Yes, I'm here.
Hey, special shout out to you. You've been working really hard, and I understand you have a scenario or a case you'd like to share with us.
Yes, ma'am.
Okay.
We had a GNA that was non-compliant with PPE and our entry screening. So non-compliant with the attestation form. During PPE monitoring rounds, we have 2 monitoring tools, one for PPE compliance and one for infection prevention. The GNA was noticed not wearing her mask properly, and then on 2 separate occasions walked past the entry screening without getting screened. One time she stated that she needed to clock in on time. The other time it was because she needed to use the restroom. But she did state that it's because the screening takes too long and she doesn't have time to do it. So the employee was actually we have staff communication meetings weekly, and she was in those, and that's where we communicate about PPE and entry screening compliance and how important it is. She did end up receiving IPIPs or performance improvement plans because of this, and on-the-spot coaching at the time of the breaches, where she did walk past the screening, and was re-educated multiple times. And we did end up having our first COVID positive in April, and then asymptomatic and symptomatic residents and staff tested positive in May. So the staff member ended up, unfortunately, being terminated because of gross negligence due to PPE and the COVID screening. So once again, it comes back to that PPE, you know, everyone's just getting tired, and, you know, unfortunately, we lost staff because of it.
Yeah. That was certainly quite a bit of quality assurance and performance improvement you just shared with us. In particular, you mentioned about monitoring for PPE compliance. Can you share a little bit more about your facility's approach to the monitoring?
So we have a PPE monitoring form. We have one for PPE, one for infection prevention, and then one for disinfecting. It's a form for each one, and then we have PPE monitors that do all 3 forms on all shifts, and then they're given to our infection preventionists.
Right. Anybody on the call that has a different approach to the monitoring? And that, I believe, is a Genesis corporate policy in a standardized form across your facilities, correct?
Yes.
Yep. Good. Including off-hours shifts, correct?
Yes.
Yes. And how are those data actually shared with frontline staff? And Cricket, tell us how they're doing it at Glad Valley.
So during our staff communication meetings, we do go over PPE compliance and the COVID screening. We go over disinfecting. We go over what products we're using for disinfecting, what works for what machines, things like that. And then we actually, as far as encouraging our staff, we do trivia and give them prizes if they get the answers correct and things like that.
Great. So other facilities have some creative way of sharing these data? Does anyone use huddles? I'm seeing, is it Lane Brinkley? You're shaking yes underneath that mask. Is that correct?
Yes, we do. We share it with our huddles, yes.
And how are you doing huddles in this time of social distancing?
If I go out and do a huddle too, there's sections marked off at the nurse's station and who can be in behind the nurse's station. And then we try to tell everybody, hey, you got to be separated out. And then we try to talk as loud as we can through our masks to see who we can on that shift or in that unit. And then we go to the back unit and separate it out that way instead of bringing everybody to one location.
I call it the Arthur Murray approach to huddles. We have little feet on the floor and everybody stands on their feet and I say, okay, now we're all going to do a foxtrot. Now, we've done that. We've had markers on the floor so that we've marked out distances. So it's not really a huddle as much anymore as I call it a formation, but it works, right? Anybody use boards or bulletin boards or whiteboards or anything? We're piloting in one unit this, what I call high-tech absurd. Looks to me like something that belongs in a stadium. It's an electronic board with some of our huddle data. It's quite neon and quite pretty, very expensive, I'm sure. And I don't know that it's any more effective than all of us in our dance feet discussing data. And by all of us, I mean a multidisciplinary approach. So we have our units of service and we have our housekeepers, our nutrition support, our nursing staff, our rehab staff, and our medical staff. We don't do it every day. We do it twice a week, but we do a multidisciplinary approach to quality improvement. So the docs and the med students are learning about the fall risks or the fall rates on our units, and we're learning about the number of patients on each unit with COVID and because we have negative pressure rooms here within our medical services. So we're learning about infection control. We get an update on our PPE, remind everybody how to get fresh PPE and to conserve PPE appropriately. So, and we do it with our Arthur Murray approach. Cricket, you mentioned your staff member had some reasons for their non-compliance. How did the leadership of your facility perhaps respond to some of those reasons?
She was re-educated multiple times of the importance, our vulnerable population, and how we need to do everything possible to protect them.
That's great. That's great. You mentioned something on-the-fly training. I love that term. I do on-the-fly with my team, and once in a while, I'll actually not gel going into a room or kind of hang back and waiting for someone to hand me a gown if it's appropriate, and sort of help set the tone of it's okay to on the fly help someone else because we are all so busy and all so challenged and all vulnerable. So I think that what you shared is great with helping each other and on the fly education. Someone mentioned, I think you mentioned trivia questions with prizes. How do you do that? How do you do that?
So we have weekly staff communication meetings, and to try and make it fun so everyone's hopefully paying attention, we would come up with trivia questions. For instance, how long the dwell time is for our chemical that we use, and then if the staff member is able to get it correct, then we would give them a prize like a candy bar or something like that.
Good. Anybody else have some clever approaches you want to share with the team on how to make PPE fresh and fun? Anyone have a challenging story like what Cricket shared with us? And trying to understand behind the non-compliance, why and what we as leaders of facilities and as frontline staff of facilities can do differently.
Now at this facility, whenever you do the monitoring and checking in someone as they come through the door, I always have a concern. And I say, have you been running a fever? Have you been having any cough, respiratory symptoms, GI symptoms, upset stomach? When I go through the whole smear, sometimes I get a pause before they say no.
Mm-hmm.
So, but I want to tell you, our management here has had to deal with that more than once on people that turn up being sick and then say, well, I was really sick when I got here, but I just didn't want to tell you.
Ah.
And they have dealt with it through management. But
Yeah.
that is a concern, and I try to pass that on to everyone. Do not lie about this. This is a no play thing.
Yeah. Why do you think people will try and hide their symptoms?
There are different reasons. They don't want to be out of work.
Mm-hmm. Mm-hmm.
Yeah.
We have agency that I don't know that they have any paid time off.
Yeah. Yeah. Mm-hmm. Yeah.
So I think it is for fear of using what time, if they do have time, for fear of using it while they're off.
Mm-hmm. Mm-hmm.
And also for fear of being an outcast.
Yeah.
Yes.
Yep. Those are all real personal and important and challenging issues. So right. So right. Mhm. Any strategies to help help with those issues? I know one of the things that we've done is a Jeopardy schedule, so all of us have a backup for any duties we have. But I think one of the challenges is there may not be someone to back up. Is that right?
Yeah.
Yeah. Yeah. No, that's a tough one. But certainly by having everyone use their PPE properly and also in their non-work environment, socially distancing, we can help keep that staff-to-staff transmission down and keep our staff safe. And in truth, we went through that this week here, where a number of our medical providers were quarantined, and it was from one social event. And you know, that was very humbling for people to, but it was shared so that people understood that this can happen and the consequences of it. And I think we've all been doing a great job of messaging the holidays coming up next week, and how important it will be for all of us to together keep each other safe. Yeah. Let's see, let me go. I think we've pretty much addressed the objectives. I'm going to share my screen again. And just to review for today's session, we viewed the video from Lisa Thompson and Susan LaGrange, and we met the objectives of listing the personal protective equipment. We've shared how we're all trying to find equipment that is more comfortable, more sustainable, more doable, and more pleasant. But the bottom line is this is tough every day, and we have to help each other. The video showed us the importance of using PPE in our quarantine units, our COVID units, and always wearing face mask inside facilities. Genesis, being a large corporation, has a network and appropriate supply for PPE and procedures in place for training and for monitoring the use of the PPE and as part of quality improvement projects. And what we've just heard is strategies to share with all members of the healthcare team. All right, somebody's got us up dancing, so you need my Arthur Murray feed. And on this program plan for today's session, there are some supplementary resources that we won't look at today, but certainly the CDC has lots of good information. I tend to send family members who are struggling with their own home situations and understanding what's happening in our facilities. I often send them to the CDC website so that they can see what we are all doing and why we're doing it, and gives that, I think everyone has such respect for the CDC that it helps everybody understand what we're doing. Leading Age also has some toolkits, but again, this is a Genesis cohort, and I certainly recognize and applaud the leadership of your corporation with your own policies and successes. And so I don't feel the need for us to review those websites today. But I did want to share this last case that's was a learning tool for us, and I think very relevant in our long-term care facilities, not so much our short stay units, but our long stay units. And that's the case there at the bottom, as I'm sharing my screen, on Mrs. Jones, who has advanced Alzheimer's disease, but also hearing impairment. And her behaviors change when staff is there with full mask and face shields. She's frightened. She can't hear because she's hard of hearing, and she can't read the lips with our surgical, our medical grade masks. And I want to hear your strategies for helping Mrs. Jones maintain her ability to communicate and ambulate and mentation. So I'll stop sharing my screen and just say we all have a Mrs. Jones. And how do we help Mrs. Jones cope through this time? And I'm looking to my colleagues in Maryland at the Waldorf Center. Lawrence, are you there? And are you able to unmute your microphone? And I'll wait a moment.
Yes, I'm here.
Thank you. And Lawrence, you are a nursing assistant, correct?
Yes.
And are you coming on shift for today?
Oh, I'm a medical record, and I'm doing. I'm the central supply coordinator too. So I just pick up some day to do the GNA like twice a week.
Okay, so but you are a GNA twice a week.
Yes.
Yes. So Lawrence, if you were Miss Jones GNA for the day, how would you? What strategies do you use every day? She's hard of hearing, and you're wearing a mask, and she's got dementia. I know that you can take care of her.
Yes, I just try to take time and talk slowly so Mr. John can understand what I'm saying.
Absolutely.
And also, Mr. John cannot understand why I'm wearing the face shield and all those masks. But I will take a time to explain and make him feel comfortable that it's not something scary or something that's gonna do something for him.
Sure. I bet you use a little bit of personal touch too, right?
Yes.
Absolutely. I can tell from your soothing voice that you do this every day. You don't even think about it. You just do it, right? And thank you for doing it. So that's great. Good. I heard on a previous call that some centers are using small whiteboards and writing a bit more than they might otherwise, because we don't have the ability to use for people to read our lips with our masks. I would suggest that somebody get some research done. I've seen the masks that are clear, and I wish that somebody would give us enough research to say whether we might be able to use those in a medical setting. We cannot now, that is not policy now, but I do wonder if we might, and I'm wondering about every flu season going forward. Will we be more inclined to be using masks in the medical settings outside of operating rooms are obvious droplet precautions? And if so, might we have medical grade masks that will allow us to lip read? Angela, I see you've come back on there. What do you think? Does Genesis have those in the works?
I wish. It sounds like I have seen the masks that you can have some clear. They're probably not medical grade, but
That's
the
what we're
ones
talking. Yeah, that's what we're
Yeah,
talking about. I'm thinking that somebody at Johns Hopkins better do a study pretty quickly before Duke because they seem to be behind us these days on a lot of studies. And I'm
Well-
thinking, wouldn't that be practical for us?
just make sure everybody on this call knows that so we can put stock in it.
Okay, all right. We'll do a little hand signal, okay? All right, so if I show up one week with a clear mask, it'll have a little name on it for the company. That's just going to be our little secret, okay? All right. One of the things we did on morning rounds the last few days is one of our nursing home residents, we learned that her hearing aids are taken out at night and they're recharged, they're rechargeables. So our interns learned how to turn on the hearing aid and how to properly place a hearing aid before we started our morning rounds. And we got pretty good at that. And that did help one of our nursing home residents communicate with us on morning rounds. Okay. All right. Angela, since you've come back on, are there anything particular about Genesis and policies regarding PPE? Anything that you wanted to be sure we talked about? Because we have this group of only Genesis facilities, so that we're sure that we meet the needs of the corporation and communicate importantly and not confuse people.
I don't think so, since I missed most of the call, but I know that Dawn Edwards was on the call, I think, so she would have jumped up, and there's good leaders. I see a lot of the CEDs, they would have been on and jumped in and piped up if something had come up, Genesis specific, so.
Good, okay. And we have Dr. Boguslavsky with us and understanding the very key with quality improvement. And I know you last call you said you had a pen in each hand and writing down all these practical tips you're hearing from our experts. Now he has 2 pens in hand again today or for this session. Any highlights you wanted to point out or anything you'd like to share with us?
Thanks so much, Michelle. Yeah, I was just gonna say that 2 pens are still on working hard. I mean,
good.
This is my first session too with the 2 groups, but there are so many great ideas that have been just discussed over the last 3 hours as we had just back calls.
Mm-hmm.
Excellent ideas, and I'm just thinking about how the this project, this echo sort of activity can help you with getting sort of ideas shared from others, but how can we better share your sort of ideas and communicate to the rest of the participants, as there are many of those. I'm just making notes. There's a lot of change ideas that even come to my mind right now, like reminders, organizing plans, place for the staff, thinking about how to facilitate the work of you, and then make it supportive, not to impose in on extra sort of work that you already been doing a lot and busy, but how this project then can be more of support, in terms of facilitating this knowledge sharing. And there's so many good practices right now. So I think I'll just stop here.
The folks doing the work every day are the most creative and the most rewarding.
Right.
Just thinking that each of our units desks each have a different sign that the unit team has made for social distancing. And it is a bit of a competition right now as to, and once a week, these signs are getting up. You talk about burnout and fatigue. They're redoing their signs every week to be more creative and more inventive and quite frankly, more fun. And so I know when the sign changes, I'm always smiling and happy to see it. And it just makes my day a little bit brighter and reminds me that I need to be always thoughtful about that social distancing and do I have my equipment with me? So with that, I'm going to say we've met the objectives of today's session for PPE, and there will be on the IHI website these resources and specific place for the Genesis library. Next week, we will not have a session because of the Thanksgiving holiday, so we'll be back the week later. I am hoping at that time we'll be able to do some breakout sessions. quite frankly, I need a little time to get up to speed on the technology, so that's why we didn't do it today. But we'll try and do in 2 weeks breakout sessions where smaller groups will get together with a couple of questions to answer and then come back as a group and share the collective wisdom. And the next topic will be on cohorting. And I know that's something that you all have been doing. I'm seeing lots of nods under those masks. So, and we're going to be doing a whole lot more of that. Sometimes I call it shuffling instead of cohorting. And I think you all understand what I'm saying, but it's very important that we, as an infection control process. So with that, I wish everybody a wonderful holiday. Stay safe, stay healthy, and keep doing the great work that you're doing. And looking forward to seeing you in 2 weeks, okay? All right, bye-bye now.
Thank you. Thank you. Bye-bye.